As you know, I like to share important information with you guys to educate you so you can help more people. And here I have a lovely lady with me, and she came complaining of two things about her lip. She said it's very, very dry. Today is a good day, but she gets actually an entire film of dryness on her lip. And also, she has noticed that she's losing the redness around the lip. And she's asking why. So you got to get a little history and understanding why. Number one history is that she successfully is taking care of her breast cancer, and she's on tamoxifen. Tamoxifen reduces estrogen levels. She's already had lost her period before, so that the estrogen levels as it is are on the lower end. But when you have breast cancer and it's estrogen sensitive, you want to suppress it even more. So after the treatment, they usually give tamoxifen for 5 years. Yes, that's what the plan is?
8 years.
8 years now. So for 8 years. So she's about to finish it. But there are a few things that happens. Number one is as we lose our hormone levels, the mucosal surface starts becoming more dry. We call it aging, but it's really not aging alone. The other thing that happens is tamoxifen exacerbates even more that situation. And so you have also loss of the beautiful lip redness that you have, and that's partly what she's complaining. But there are other things that are responsible for that and things that you can do to help improve that. And one of the things that she tried to do is she tried to switch toothpaste, and she's correct. There are certain toothpaste that will be more irritating to the lip. The other thing that she's very smart that she is not doing, that a lot of my other patients, unfortunately not knowing, are doing it, they're using mouthwash. The mouthwash also dries the lips and causes irritation. When you're doing the facial cleansers, also they go on your lip and they're also drying it. She just uses plain water, which again is very, very smart. So the only thing that we need to improve in her situation, that we can improve because she has to be on the hormone suppressing medication for her health, is two things. One is overall improve her health. And so I asked her about her hemoglobin A1C and her sugar levels, and she said she's borderline. Well, let me tell you, in my opinion, borderline is saying like, I'm borderline pregnant. You're not borderline pregnant, you're pregnant. Maybe you're at the beginning of your pregnancy, but you need to take care of it, because if you have too much sugar attached to your hemoglobin, which is what hemoglobin A1C is measuring, you have too much sugar attached to other parts of your organs, and that makes them age, that makes them sluggish, that makes them function less effectively. So you want to do something. One of the things that is very safe and has been proven to be safe in people who have actually breast cancer, they've done study with, I can't remember the numbers, but if I recall, somewhere around over 20,000 women with very aggressive breast cancer to see if hemoglobin A, if metformin, which is treating the elevated sugar level, if it will help reduce the recurrence of the cancer. It did not help reduce, but the positive effect is it didn't worsen it either. So forget about, for now, about the breast cancer recurrence rate. Let's talk about the general health. She needs to improve her general health, because as she's suppressing one thing and she's not helping another thing, the overall cumulative effect is she's suppressing her general health. So we need to improve her general health, and metformin 1000 milligram every morning with a breakfast is a great thing. And as I tell you, I always experiment on myself, and it's one of the things that I've experimented on myself too. The other thing that you can do, simple things. You don't want to take the pills. It's fine. You can still improve your health. And the way you do it is you do the same thing that your body does when it works around the joints. When you wake up in the morning and you have arthritis, for example, you feel hard, difficulty, pain, trying to move your joints. But as you move them more, you start losing that pain, that difficulty, because the body is able to produce more of the moisture, more of the oil, in order to allow to lubricate the joints so they don't hurt as you move. The same thing should happen with the lip. It has to produce that oil. But because the hormones are down, because we're over drying it, because the weather may be also over drying it, we have more factors fighting against our natural ability to produce the necessary oils. So what we do, we supplement. It's easy. So we put a little water first on the lips.
Okay.
And after we put the water on the lips, we put the extra virgin olive oil. Natural, yes. Beautiful, we do pasta, we like it. And then you brush your teeth. Mm-hmm. Right. So then what you have is as you're spitting the gargled detergent from your mouth, it does not irritate the already dried up lips, and so it protects them. And that's what you can do. So you keep a little bit in your bathroom of the olive oil. Right before you brush your teeth, you first do that, then brush, and you're good to go. And then you can also put a little bit of the lip balm as it is you would have done naturally, and that will help. In terms of the color of the lip, let's see after you're done with the tamoxifen and everything else, and I will try to suggest how we can improve it in aesthetic, natural, healthy ways. Okay? Okay. So we'll also give her the metformin. Her hemoglobin A1C was actually 5.9. So I would recommend that to do. And again, speak with your oncologist, make sure that it's okay. Yes. I'll prescribe it to you. If it's okay, they say, okay, you can take it. Yes. If not, don't take it. And then repeat your hemoglobin A1C usually in 3 months. So I'm giving her some creams to start off the process. So I'm going to give her, this is Absolura. It is a non-steroidal cream that will help reduce eczema. It's not going to be covered by insurance, unfortunately. Expensive stuff. This is like $3,000 prescription. So I'm just fortunate enough that they're giving me samples so I can share it with the patients. Hopefully this was educational. If you have any questions, just reach out to us, and stay healthy. Be good, do good, and may good come your way. Thank you. If you liked the episode and found it useful, please let us know by liking us and leaving a comment. Thank you.